Presenting 80 UK patients with pathogenic CTNNB1 variants. Please welcome Taisiia Sazonova, MD, University of Oxford, Merton College.
Morning, everyone. Good morning. Thank you so much for inviting me today. My name is Taisiia Sazonova. I'm a medical doctor by training, and now I'm working on my PhD project at the University of Oxford. And today I'm delighted to share with you our insights, clinical and genetic observations from the UK cohort of patients with CTNNB1 pathogenic variants. First of all, I want to start, as many speakers started yesterday, what I'm actually working on and what is my relation to CTNNB1. So the main goal of my PhD project is to find novel genes that are causing neurodevelopmental disorders. And how we are doing it, we are trying to find it through using a network approach to find genes that are interacting with two genes, SADB1 and SADB2. And this is how we can find novel genes. And when we started analyzing genes that have interacting with SADB1 and SADB2, where is SADB2? I can't find it. We found that, there are many genes, around 80 genes that are interacting. So dots are genes and the lines that show the interaction. We saw that the CTNNB1 is located in the middle, and it looks like that it's we all know that it's causing neurodevelopmental disorders, but it looks like that it's interacting with many genes. And we decided to check what type of research was done in the UK about CTNNB1, how many patients there are in the UK, and this is why I got interested in this topic. So you all already experts in the CTNNB1, but I just want to highlight that you all know that CTNNB1 is encodes catenin beta-1 protein that is very important for embryonic development and intercellular signaling. And you all know that CTNNB1 plays an important role in Wnt signaling pathway, and it works as a transcriptional cofactor, facilitating the transcription of genes that are involved in development. And of course, you all know the main symptoms, how patients are presenting with microcephaly, with hypotonia and spasticity, with developmental delay, with intellectual disability, eye abnormalities, different neurological features. So I don't want to talk a lot about it. And there were many papers describing genotype-phenotype correlations in patients with the CTNNB1, describing their phenotypes and details. But what we found that none have explored such a large UK cohort of patients with CTNNB1 mutation. So we decided to do this. So the main goal was to explore the genotype-phenotype correlations in the large UK cohort of patients with pathogenic CTNNB1 variants, and we were focusing on developmental, neurological, and ocular outcomes. So we found 81 patients that were previously unreported in the literature, and we were searching for these patients in three main databases, three main sources. So the first one, we found 45 patients through the DDD study. So DDD study, it was a big study in the UK that collected data from 13,000 patients with severe developmental delay, and they collected their genomic and phenotypic data. So in this database, we found 45 patients that have been previously unreported in the papers. Also, we found 23 patients in 100,000 Genome Project database, also with pathogenic CTNNB1 variants. And this project was also in the UK, and they collected 100,000 genomes from 70,000 patients with rare genetic disorders and cancers, also to study their phenotype and genotype. And also we found 13 patients through the NHS diagnostic labs. So when we were working on our data that we found, first of all, we checked that for crossover to avoid double counting of patients who may be testing through multiple routes. Also, in this analysis, we included only patients who were unpublished before in the literature. Genetic analysis for these patients was conducted from exome and genome sequencing, and all variants were classified according through ACMG guidelines. So you all know that it's like a standard way how we are classifying the genetic variants that we found in patients to find out is it pathogenic or likely pathogenic or benign and so on. Phenotypic data, unfortunately, was available only for 74 patients in our cohort, and the phenotypic characteristics were categorized using HPO terms. So it's also like a standardized way how we explain the phenotype in patients. So this is the general overview of our 81 patients. So the age range of our patients was from 1 year old till 20 years old. It was the age of last examination, and the mean age was 5 years old. In terms of sex, our group is quite balanced. So 52 were females, 48 were males. In terms of inheritance, 70% were de novo mutations, 5% inherited autosomal dominant, and for 23, the inheritance pattern is unknown, unfortunately. And in terms of effect variants, so it's very similar to the data that Professor Sanders was showing. So like the majority of variants were nonsense, frame shift variants. There were 12% of splicing variants, deletions, duplications, and one missense variant. So here you can see the variant distribution. So as you all already know, that CTNNB1 has 12 armadillo repeats, and CTNN binding domain. This is all the variants that we found in our patients. And the red is nonsense variant, green is frame shift, blue is missense. So we found only one missense variant in our cohort of 80 patients. And as you can see, variants are distributed across the protein coding domains and also across all exons. But there were some recurrent variants. So you can see here for patients with the same variant, here and here. Yeah. And this is the general overview of clinical manifestation of our patients. So it's also quite similar to the data that was already published. So 87% of our patients were presenting with developmental delay. So it includes global developmental delay, delay in motor development, intellectual disability. 66% were presented with microcephaly, 40% with abnormality of muscle tone, abnormality of the eye, 36% were presented with abnormality of the movement. So it includes poor coordination, dystonia, ataxia, also typical for CTNNB1 craniofacial dysmorphism, and as well as abnormality of musculoskeletal systems such as scoliosis. So this is more data about developmental delay that was found in our patients. So as I told you, the majority were presented with global developmental delay. And unfortunately, because like the clinicians were using HPO terms, so it's very difficult to say what exactly they will, it's very difficult to extract the details from this global developmental delay. So it can be intellectual disability, it can be also delayed in speech and language development, in delay in motor development, or just in general global developmental delay. For 6 patients, clinicians said that it was a delayed speech and language development, and for 7 patients, they said that this was specifically delayed, patients were delayed in motor development. This is some data about developmental milestones in our cohort. So unfortunately, this data was also available for few patients. And on this slide, you can see in orange is the main age of reaching the developmental milestone for CTNNB1 cohort, and the blue one is for healthy general population. So for the first developmental milestones, social smile, we can see that CTNNB1 cohort is not that different according to our data from the healthy general population. But for first words, for example, we can see that the CTNNB1 cohort is delayed from the healthy population. Then also we got some data about reaching the milestone sitting independently. So again, we can see that CTNNB1 cohort is presenting with a delay. So patients were reaching milestone sitting independently by the age of 19 months, when the healthy cohort should reach it by the age of 8 months. And the similar picture with walking. So the patients were reaching the walking independently by 34 months, and in healthy population is doing it by the age of 12 months. Abnormality of the muscle tone. In our cohort, only 31 patients were presenting with abnormality of the muscle tone, and from them, only 25% were presenting with spasticity and hypotonia. And also we were trying to find, maybe there were some genotype-phenotype correlations. Maybe there were some specific variants that were causing spasticity in these patients. But unfortunately, we can't say based on our cohort that we found some really correlation. We can't say that there are some variants that are causing spasticity in the patients. 41% of our patients were presenting with eye abnormalities, and the 15 of them were presenting with strabismus, 9 with hypermetropia, 8 with astigmatism, 3 with nystagmus, and with other eye abnormalities. And what is interesting, that it was reported in the literature that CTNNB1 can cause a rare genetic condition called familial exudative vitreoretinopathy. And we were quite curious to see, maybe we will see some patients presenting with retinopathy in our cohort also. And we found one patient presenting with familial exudative retinopathy. And we decided to check in the literature which variants were reported to cause retinopathy. So this is the data from the literature from case report that was published, which variants were causing familial exudative retinopathy in patients. And you can see, like, so we decided to compare these variants with the variants that we found. And there was one variant that we also can observe in our cohort, but in our cohort of patients, these patients are not presenting with retinopathy. And our patient is presenting with another variant, with this variant. And we have 3 more patients with the same variant, and they are not presenting with retinopathy. So this is quite interesting. Maybe patients will start presenting with retinopathy with visual loss later in their life, or maybe not. So I think it's very interesting to study more in details the risk of retinopathy in these patients. Yeah, so as you remember from the slide that I showed you before with variant distributions, we found 6 patients with this variant, arginine 535 terminator. And we decided to check maybe there are some consistent phenotype for these variants. And yeah, we found that the majority of them are presenting with global developmental delay. So it's not that specific, microcephaly, intellectual disability. 3 of them were presenting with delayed in speech and language development. Also, we decided to check these patients. So with this variant, we have 4 patients, but here I'm showing only 3, but the patient number 4, he was presenting only with retinopathy, so only with visual loss type of symptoms. So there were no symptoms of developmental delay and other neurological features in this patient. But we will be following up this patient more in details because maybe this data was just not reported in a database. And in terms of this variant, so patients were presenting with intellectual disability, microcephaly, so nothing very special. And for the next variant that we have 3 patients also, tyrosine 333 terminator. Here, for all 3 patients, the clinicians described their developmental delay as severe developmental delay. All of them had abnormality of movement, microcephaly, intellectual disability. So probably there is some genotype-phenotype correlation in these patients, but we need to get more data to make a conclusion about it. Also, I want to say that in the UK, I showed you there are at least 80 patients, and also there is a big group of parents. In the Facebook group, there are more than 60 parents. And I asked them before coming to this conference, what is bothering them, what is important for them. And they were all asking, of course, as all parents, about the chances for regression of this disease, how their child will be developing with age. And also, of course, they're interested in the treatment opportunities and the clinical trials. Let's move to the conclusions. So our study represents the largest cohort of UK patients reported with CTNNB1 variants. The majority of variants, 80 variants causing the disease, were loss of function, and we found only 1 missense mutation in our cohort. The pathogenic variants were distributed across all exons and protein domains in CTNNB1. Spasticity was observed only 25% of patients. Familial exudative feature retinopathy is a rare complication and was observed only in 1 patient and caused by particular variant. But from our point of view, it needs monitoring and needs more research about it. And also, of course, in our research, there are many limitations, but for now, we can say that there is a lack of genotype-phenotype correlation. And it's confirmed, suggesting that we can't use genotype for this disorder to use it as a prognostic indicator for now. Thank you so much for your attention, and let me know if you have any questions. Thank you.